Welcome everyone to our October webinar for optimizing newborn nutrition, our GaPQC neonatal initiative. I'm Kimberly Ross. I'm the neonatal quality improvement coordinator at the Department of Public Health and support this initiative. Today we are providing some updates on the collaborative and allowing some time, what we're calling office hours. So some time for discussion, Q&A, just bringing any questions you may have, any topics you want to discuss. We can go back to prior topics, just using this as a bit of time for discussion and catching up on all of the learning we've done to this point. But we do have a couple updates. I'll start there. As I mentioned, today we're going to give you some updates. We're going to go over a couple of the common questions that we've been receiving, just making sure everyone's getting the same information. We do have an update on the audits and our most recent data, and then we have time for some open discussion. First, I want to say welcome to our new members. We have had new hospitals join. We are up to 27 hospitals in active improvement. That represents 38 sites, and there are 9 hospitals represented in the Learning Collaborative. So if you are new this month, welcome. So happy to have you here. And this map we will be making available on the website so that you can see, toggle in and out and see hospitals that are enrolled and if they have a NICU or mother baby or both enrolled, to kind of see who else is out there along with your hospital teams. I've mentioned this the last couple of months, but it is still an opportunity. So I want to make sure we all are aware of IPQI, the Institute for Perinatal Quality Improvement Speak Up Champion training. There is an October session that starts tomorrow. It's tomorrow, the 12th and the 19th. There's another training option in May. It's the implicit and explicit racial bias training. There are still some spots available for the October training. So if you are available those dates, you can go ahead and reach out today. And I will send the link in the follow-up email after this webinar and sign up for that. And if October dates don't work for you, the May date is available. It's free for you. It is Georgia specific. It's only for physicians and staff and participants in Georgia. So please take advantage of this wonderful opportunity. We will keep sharing this until the May opportunity as well. We want to let you know about the upcoming educational sessions so you know what to be looking forward to. We have November, we'll have our webinar on keeping mothers and babies together to optimize outcomes. We'll be hearing from 2 of our hospital teams. We're excited to hear about the work that they're doing in this area. We'll have a quality improvement specific webinar in December, looking at different quality improvement tools and other areas. Then lactation risk assessment will be our topic for January. And February, we'll be able to look back at our 6-month structure measure update. We did the structure measures in July. We'll do them again in January. So we'll be able to look at the results of that, see if we've had any movement there on those policies and structure measures. And we'll also be talking a bit about donor milk and the guidance around the reimbursement for Medicaid and some other information there. In March, there's the Emory Breastfeeding Conference. We will be, as we did last year, sponsoring a few, sponsoring registrations for that, for GaPQC enrolled participants. So more details to come as we get closer to that date, but that will be in lieu of our webinar that month because it's the same time period. And then the GaPQC annual conference, same thing, is happening that same week where our webinar is scheduled. So we're encouraging people to attend the annual conference that week, and more details to come on that. Just wanted to get this on everyone's radar of all the exciting things we have to come. On to some common questions. Just want to make sure that I'm getting the information to everybody. I've had a few folks, we mentioned the micro lessons are on Train, and people are asking, wait, what is Train? Train's our online learning platform. So we're putting short lessons on Train that accompany the monthly webinar topics. They're self-paced. So after that month's webinar, you can go on to Train at any point and take those micro lessons. You can go back and take any of the ones that are on there. They stay live and open to access. So if someone joins in March and wants to go back and take all of the lessons, they're available. You do have to sign up for an account. It's a free account. You just have to have the account to be able to access the webinar or the micro lessons, excuse me. Once you log in and the link is there, I'll also send it in the follow-up email. After you've made your account, when you log in, there's a search bar and you put GaPQC, GaPQC, and the micro lessons will come up under that. So you'll be able to see all of the ones that are there. And each micro lesson ends with a short quiz, a brief assessment. Make sure you take that because that will show that you fully took the micro lesson, because we're able to pull the attendance record for that, and you won't show up as completing the course unless you finish that assessment. So just make sure that you've gone through all the way through and completed the assessment with each of those. Another question we've gotten is around communication from GaPQC, around some people are not receiving communication. If you're here, you probably are receiving communication, but if you have team members or anyone at your facility are saying, oh, I haven't heard anything in a while, make sure that they are registered with Optimizing Newborn Nutrition. So make sure either their email address is sent to me, my email address is there, or there is a Google link that I'll put into the chat, and that will, it just takes you to a Google form. And you can put email addresses in there and their names and their hospital they're affiliated with, and we'll add them to the list that way. Let's see if we can get the chat now. There we go. So that's in the chat. So 2 ways to get the information to me. So again, if you're hearing from folks that are saying they're not getting something and they can't access Teams, any issues there, make sure that their email address is either submitted through that link or just directly to me via email. And a couple questions about audits. The audit links are sent out to the data leads for hospital teams that are in active enrollment on the Monday of the last full week of each month. We ask that audits are completed during that week, but if you need more time, I can leave that open. Just let me know and I'll leave the link open. Otherwise, I close it out and we close the data collection, but happy to leave it open. I just need to know. We do ask that it is done that week, but we can be flexible on that. So the October audit will be coming out October 24th. So that's the last full week. Monday, the 31st is the last Monday of the month, but it's not a full week. It moves into November. So we're doing that full week. So it's always the last full week of the month. So this month it'll be the 24th. And then along the lines of audits, I wanted to hand it over to our co-chair, Dr. Patel, to talk about our September audits and what our data is showing.
Thank you, Kimberly, for that. And I'm going to just share these from my side. I wanted to give a quick update on our audits. This is our 3rd month of audits, and one of the things it was great to see was we really have continued to have, and in fact maybe increased our hospital completion rate. So to thank you for the engagement of our hospitals that have participated, even as we've grown the number of hospitals that are participating in the initiative. We've also seen that you all are putting efforts in terms of giving us a snapshot of how you're doing. So this is our primary measure for the collaborative. You can see we've been pretty stable across our 3 months of audits for July, August, and September. And as for those that were on our last month's call, we had said we would set our baseline, which is right where we're in line with, which is, I think, exciting to at least know where we stand. We have data to say, in the last few months, how are we doing in Georgia with human milk as a first feeding? And so this gives us a sense of where we are. And we also talked about SMART aims and where we hope to go. And so what we have set as our goal at the end of this initiative is to try to get from our baseline of 73% to at least 80% or higher in our performance of human milk as the first feeding. And tied to that is our overall collaborative SMART aim, which is to increase the percent of newborns in our GaPQC hospitals with human milk as a first feeding by 10%. And to go from our baseline of 73% to 80% by September of 2024. And so this is, as we've gotten started, we've tried to really try to start with getting some idea of the structure of hospitals, providing education, getting a sense of where our baseline measures are. And over the course of the next 6 months, we'll be talking about continuing to have discussions about change ideas, about smart aims, and about process improvement tools that you can use in December about how you might actually use some quality improvement science to make some changes. And so this is what we'll be tracking and continue to measure. Some of our other two measures, formula supplementation of the last week, you can see that data here, about 48% from our September audit. And then breast milk breastfeeding within 6 hours, and this is collected for those hospitals where it's relevant. It's not relevant to all of our hospitals. For example, some of our children's hospitals that are accepting a large number of outborn or have outborn infants, and that's about 50%, which is right around where our overall measure has been. Now, one of the reasons we've collected 3 measures and not just one measures, we think these 3 measures, we chose these based on what other states were doing. We think this gives you 3 important snapshots of how you're doing in your hospitals, whether that's in the well newborn, mother baby setting, or the NICU. And I think it can also help to guide improvement. And so one of the questions, and we'll come back to, is it really thinking about, this data here is not just for the sake of collecting data. We really want you to use this in terms of how are you using this data that you're collecting and sharing it with your teams, whether that's with your broader hospital teams or with other leaders in your hospital. We'd love to hear from you about that and how you're sharing with hospital teams. And the second is on smart aims. And one of the things we said when we talked about smart aims is we really set kind of an overall GaPQC smart aim, but we want to hear about your smart aims that you're doing. And I think it's important to consider really what you think is the biggest opportunity at your hospital. And part of the reason we wanted to have flexibility is to really meet hospitals where they are in terms of their performance. And I'll give you an example. This is from our data last month. And if we look at where we were last month, there was one hospital that had 100% human milk as a first feeding. And so for the hospital, focusing on human milk as a first feeding, and if you look at the prior dates that hospitals, about 90% of infants are receiving human milk as a first feeding, that might not actually be where this hospital decides to focus their energy. That same hospital that had 100% human milk as their first feeding had 60% of infants receiving formula supplementation. And so this data might say, we were doing pretty well with human milk as a first feeding, but maybe we really need to focus on the second data point, which is formula supplementation. By contrast, there's 3 hospitals that have 40 to 50% of their infants that have audited that have received human milk as a first feeding. So these hospitals, I think, would have a large opportunity to focus on this. And what I would ask you hospitals that are on is to think about really what you want to improve. We really don't want this to be something where we're collecting data without thinking about really how we're going to improve. And so as we're thinking about smart aims, to think about the data that you're collecting and how that might guide improvement. And we have 3 pieces of data that you're collecting on a monthly basis that gives a snapshot. And so that was really to come back, and I'd love to hear from the hospitals on kind of your questions about these 2 questions. How are you sharing some of this data with your hospital teams? And have you set your smart aims? And tied to that, the last piece I wanted to mention is we've really been working at the state with our DPH epi colleagues to really try to create quarterly reports for all the hospitals. That's something that's been in the works, so we can give you direct reports. I know you're collecting the data, so you probably have a sense of how you're doing, but to give you quarterly reports so that each of the hospitals can know how have at least on a quarterly basis some reports. So that's something that's in the works that's supported by our the state epi folks. So I'm gonna I'd love to hear from those on the call about maybe the first question: how have you been sharing this data with your teams, and how are you doing this? Is this something that's shared by email? Is this incorporated into other meetings. And so I'd love to hear from the group that's on today about how this data might be shared in terms of creating a situational awareness and shared understanding of kind of where you stand with some of these measures.
I'll go ahead and speak up. I'm Amy Thompson. I'm one of the neonatologists at Augusta University. We are participating, both our mother-baby units participating and the NICU separately. We are hoping to do a kind of joint project because right now there's no way of seeing when mothers have first expressed milk. And since we have a labor and delivery unit that is attached to our children's hospital, and a lot of our babies are inborn, I feel like that'd be a good measure to try to encourage moms to start production. So that's where we're kind of starting right now. We have not had our first official meeting all together. I'm just getting back from my own maternity leave. So that's going to be in the next couple of weeks, get together to try to start that.
Great. Well, thank you for sharing that. Kim, I see in the chat, do you want to try again to see if you can share? So one of the things that I would suggest is thinking about how you might build some awareness of your of these measures. And so I see in the chat that Kim said she's sharing the data with the Women's Health Services Division and the members of the that are on for the hospital. Make use of this. I think people, you or people at your centers are going through the effort of collecting this data. Let it be useful in terms of giving a snapshot of, hey, we're doing really good in this area, and share that. I think you should, those hospitals that have high performance for human mucus first feeding, I think it's great to share what you're doing well, but also where you might have opportunities for improvement amongst these measures. And then I think that's always the first part of where you stand in terms of what do you want to improve, and then how the changes you can make, what changes will result in improvement, and then you have data to show how you're doing. Have any of the hospitals, you can either put in the chat box or unmute and share, have you finalized smart aims? And it's okay if you haven't. Part of our goal here is to give you information and to stimulate some of the things that you would want to work on before you finalize, but some of you may have already settled on what aims you want to work on. So from some of our other hospitals, so if you have a smart aim, we'd love to learn about what you're working on, if you can share that.
Hi, this is Condoleezza Ann from Atrium Health Floyd, and one of the things that we're working on, we're participating in our newborn and our NIC unit, but what we decided to do, we've shared the information with our neonatologist and the staff, and educated our staff on working to get our our babies to have the colostrum as their first feed within that first 6 hours, whether it's just by using it for mouth care or whatever. So what we've done to kind of remind the staff of this, we actually fix little yellow cards and put information on there. Please remember to get my colostrum, and it's yellow. And it's placed there, and the staff actually will mark yes or no. And then I can round and kind of see who's getting it, and the staff that maybe miss it ask why, or, you know, what were the reason we were not able to get it. So it's kind of a visual reminder to the staff, look, we got to work and be sure. So what they usually do is notify either our lactation, labor and delivery, or our store nurse to tell them, we need this as soon as you can get it. Then they bring it to us, and we use it, like I said, whether either for just a small feed or mouth care for within that first 6 hours.
Great, thank you for sharing that. I think that's a great, one of the principles of improvement is making the system visible. And I think one of the things you're doing is exactly that, making it visible to the staff and also for you of how you're doing. So that's great. Other hospitals?
Dr. Patel, this is Claire Eden. Can you hear me?
Yep. Hi, Claire.
I just wanted to jump in and remind folks, if you're kind of wondering about where to go from here, we do have the discussion guide that we developed earlier this summer available on the Teams website. If you want to kind of get a group together to talk about a couple different questions on there to get the juices flowing, then that's still available to y'all on the Teams site.
One of the things I just saw that Kim Cooley has put in the chat is, collecting additional data. And I think one of the, if there are other measures that are really important, we heard a great example from Floyd about colostrum care, and another one about if collecting additional data around race and feeding, and we'll have kind of more on that. We'll talk a little bit more of on that kind of as this initiative progresses, that those are great opportunities on kind of collecting other measures related to improving newborn nutrition that are useful for your practices that may not be things that we have collected as part of our audit. So thank you for sharing that. And I think just something to think about as you're progressing. If there's something you want to work on and it doesn't tie to those 3 measures I just shared, don't let that prevent you. You can always use the same audit framework to collect this data and track it over time and see how you're doing. And it doesn't have to be, that the denominator if every month is 10. So you could draw out a chart and just add a dot point that's going to be either 10, 20, 30, 40, 50, 60, 70, 80, 90, or 100%. And you can just put a dot every month and track it that way. As one option, but think about other measures. If these 3 measures aren't capturing exactly what you want to work on, that's okay. You can collect additional measures. So we also wanted this to be a time for all. We wanted to build some time in this collaborative to have some unstructured time where we can have discussions without just the didactic built in. And so today's also kind of questions that you all have, or either for us at as part of the neonatal committee and or for other hospitals. If Claire or Kimberly want to add in, but we'd also love if there's questions that you have that we haven't answered yet. that might be a good opportunity, because if you have those questions, it's likely that other hospitals may have the same exact questions. We'd like this to be a forum for you to bring that up. If there's questions about some of the training, about some smart aims, some of the data, or other parts of this collaborative, you can put them in the chat if you'd like, or unmute and share some of your questions or comments about your experience so far over the last few months of this initiative. So Kimberly, do you want to take that question that comes in about completion rates for the micro lessons and how we're doing for the micro lessons?
Sure. I think we're going to try to tie those with the quarterly reports. So when you receive quarterly reports on the audits, we'll be able to tie in the completion rates for the micro lessons for your hospital. We're also, just to give an update, we're working on the GaPQC website to add more resources there for folks. We do have teams, but we know teams can be finicky sometimes. And it's also difficult for you all to share outside of folks who are who have Teams access. So if you wanted to send a webinar link to someone who isn't maybe interested but hasn't registered yet and enrolled yet, you can't do that. And we really want people to be able to share what we are doing with optimizing newborn nutrition. So we are thinking through ways to have the webinar recordings on the website so that you can share those, to have the upcoming webinar topics there, to have dates, important dates like the audit dates, that sort of stuff there. And then anything else, if there's something that you have been thinking, man, I'd love to have that at my fingertips on a website, please let us know. We want it to be something that you go to and can get everything that you need there when it comes to resources, and especially when being able to share about what you all are working on and what the collaborative as a whole is working on. So that's something that we're tackling now. Update on our MPINC completion rate for Georgia. Claire, have you heard anything about where we are? And that is a good, thanks, Kim. That's a good reminder. MPINC is open until the 17th. So that's the CDC's survey that has gone out to each hospital. So if you could talk with folks at your hospital to find out if you all have submitted it yet. Claire, do you know what our completion rate is?
Yeah, I'm looking to see what the latest one, I mean, it has been bumping up, but we were still pretty far behind in Georgia, behind the PACE rate. And I'm looking at what I heard last. I think it's been, they only put that out once a month. The participation rate, it was 47% and at the beginning of September, but I don't, let's see, fewer than 42% on that's August 30th. So I think they put it out at the end of September, and it was like 49%. So anyway, we're still behind, and I will put the link in the chat to some more information. I know when we had a webinar a few months ago, there were several folks on the call who weren't familiar with the MPINC. So I'll put some links in the chat, but just also as a reminder, speaking of the website, there's the recording from last year's GaPQC meeting, all about the MPINC from our friends at CDC. It's not very long, so it's a good way to get a review of how the data is used and why it's important.
Thanks, Claire.
And I'm putting that link in the chat to the
Oh.
recording last year.
Thank you.
And one of the things that MPINC does, it's something you only get every 2 years, but it's also another piece of, for those hospitals, one of the great things of participating is you get a hospital-specific report that can also be a way to see where you are in a much broader range of nutrition and related practices for your hospital. And so that you also get the benefit not only completing it so that we can give the CDC a good snapshot of how we're doing in Georgia, but also your hospital will get in return a hospital specific report that gives you a sense of how you're doing and how you compare, because it may be that for a large number of these measures you will be better than kind of the benchmark of US hospitals in some measures, and for other measures you may have room for improvement, and this can give you that kind of individualized data.
The links I put in should be hot links in the chat to click on. So if your hospital's ever participated, then you'll have a report from that year, an individualized report back from the CDC.
Another question we have for you all for some feedback. We shared the education plan and opportunities going through April, and we do have plans, topics that we're going to cover after April. But we do want to know, are there specific topics that you would like to see us cover, either in a webinar, in a micro lesson, something that you were hoping that we will cover to make sure we have it on our list? Or anything that we may have covered, but you want to go into more depth on, maybe through micro lessons?
Just hearing about the initiatives, one of the things that might be nice that we don't have measures on, but on colostrum care and having a discussion on that might be a good topic for after April of 2023. So that something we can put back to our neonatal committee and discuss, because I think it's good to hear that at least one of our hospitals is going to be focusing on that.
Yeah, and I know there were some questions, Dr. Patel, about and I think maybe the Floyd rep who was speaking earlier kind of touched on this, is the difference between receiving express colostrum as a first feeding versus oral care with colostrum, which wouldn't necessarily be considered a feeding. So I'm just trying to anticipate that we might want to have some clarity around that for our NICU teams, particularly.
Yeah, that's something we can I can clarify. I think that the goal for measuring kind of timeliness of expression or breastfeeding was, I think nicely highlighted in our kind of talk about time as tissue, and you heard some of the prior discussions around kind of the importance of timeliness. I would say we, putting time. One of our hospitals has worked on time, on colostrum care, and sometimes for babies, considering the context of those patients in your unit, for somebody who's in well newborn, where the goal of kind of timeliness of expression is going to be different than infant, a very tiny baby in the NICU that may not be ready yet to eat, and where I think colostrum care, that population where some of the data would say colostrum care is important, but timeliness of breastfeeding. And so I do think that some of those are going to be dependent on kind of the context of the patients that are in your hospital that you're monitoring for. And Claire, I don't know if you want to share any thoughts you have on kind of when we think about timeliness, whether there's importances of considering the timeliness of colostrum care specifically.
Sure. I mean, I think one of the things that always comes to mind for me is how it reinforces that when we're using the express colostrum and kind of treating it as valuable and kind of like rushing it to the bedside, kind of, theoretically of the baby, that reinforces to the mother the value of her time spent and really, as was highlighted in the webinar, that not only the timeliness, but the setting up a system in which the expression continues, that there's a plan for expression to continue frequently. I've had patients where, they got some feeds at the beginning, but then it's sort of, if there's complications or with mom or, I've had parents say, well, I was on an IV, so it was hard for me to pump on my own, that we have a system set up throughout the shift for mom to continue to express. And then since oral care is provided on a regular basis, then, keeping on using that freshly expressed colostrum, even if it's only a few drops or milliliters, can reinforce that frequent removal during the first few days, which is really critical for long-term milk production. So yes, it's great for baby and it's immunological support for baby and it's a pleasurable experience for the baby. And if parents can be helped to do it themselves and shown how to do it themselves, that's even more ideal. But I really think it can play an important role in kickstarting abundant or robust lactation in the first few days from the parent's point of view too.
And tell you that I just noticed a comment here from QC Nation about direct breastfeeding as well, and from a project that Children's Hospital Neonatal Consortium is doing, and so I think that's a great example of maybe some synergy between what different groups nationally are working on, as well as what we're doing in the state. And whenever possible, it's always good if you can find alignment with things that your hospital might have that you might be working on for your participation and role in GaPQC with other projects that are going on, and if it's possible, sometimes to try to synergize those things so that you can have some alignment in what may be a key measure in your hospital with what GaPQC is working on.
I think there's a great question from Kelly in the chat. Is there anyone else who wants to give any suggestions on how they handle kind of this has come up a couple times around like the supplementation rate tends to go up over night shift. And I think there's probably several factors in that. One, it can be like, we might have fewer experienced nurses on night shift. There's less access to lactation consultants on night shift. Everyone's more tired on night shift. I'm hoping that some of y'all who are on the call would have some suggestions on, in case you can't see the chat, about night feedings and tips for nurses to avoid turning to formula. I'm supposing, Kelly, if you can unmute, do you mean about like when parents are asking for it, or when,
Well,
under what circumstances do you mean?
I'm sorry, I was back on the micro lessons and thought that would be a good one to put out there for staff to help them. Is there anything out there that they can use as resources to learn what to do at night. Like you said, there's less staff and they're newer, and it tends to not have any CLCs or lactation consultants on the staff. So I think when a mom gets frustrated and they're tired, then it's easier to just go to the formula. So I didn't know if there was a lesson that we could have in the future on that for the staff.
Yeah, no, for sure. We can definitely incorporate that moving forward. But I guess I would still love to hear what solutions some of y'all are, that we can include when we present on this. I know some hospitals have identified like a lactation kind of or breastfeeding champion for shifts, especially from among their night shift kind of pool of staff. Maybe prioritize night shift staff for training, coming up with standard scripting that you include in your annual competencies that kind of walks through options around hand expression. Is the need that the parents just need education around frequency and cluster feeding and kind of the role that plays in driving lactation. I know those are some that are coming to mind that I've heard other folks share. If anyone else has something to add in, I'm sure everyone would love to hear it, or you can message or put it in the chat. Oh, and I think there's one hospital that has, they have peer supporters, like lactation techs that only work at night. So they're not lactation consultants, but there are more tech level educators that have experience with hands-on helping of latch. So they wouldn't be providing like formal lactation consulting type assessments, but can be an additional resource at night that may be easier to staff in terms of budgetary concerns than getting lactation consultants at night. And I have a couple job descriptions for that type of role, if that's something that your hospital is considering. I'll put my email in the chat just in case. Really nice feedback, Casey. That's a great suggestion about incorporating the partner or the co-parent. And that's actually on, yes, we want to do a whole micro lesson on engaging parents and grandparents and support people.
One of the things that, Casey, thank you for the comment, is engaging parents and families in your teams if it's possible. This is one of those areas that's been a challenge for lots of hospitals, of having families and patients and parents be part of quality improvement teams in your hospitals. We'd love to hear if that's something that you're doing. That's something that I know in many different quality collaboratives is a push that people are making, just really to frame the importance of what you're doing, and also solutions and ideas that can help support people. So if some of you have parents that are in your quality improvement team or parents to be, we'd love to hear how you're engaging them and working with them for your quality improvement work, and to learn from you. So please reach out to Kimberly if you're either planning on that or already doing or already working with either parent advisory groups or patient advisory groups in your hospitals on this improvement project. But as we get close to, and I'd like to kind of give a little snapshot of how we're doing as a collaborative. You know, where should you be and where are you doing as a hospital? I think we've really been excited with the number of hospitals engaged in this. 27 hospitals across Georgia is really, it's phenomenal. When you look, we shared this a couple of months ago. One of the larger number of hospitals participating in improvement in newborn nutrition. We've had high completion rates of data, so thank you to our teams for collecting these audits. We really want this to be kind of at the core. The first thing we wanted to do is to get a sense of what our policies are. We have a good snapshot of that. We'll do that again in January. One of our goals is to move some of those structure measures related to key aspects of policies that impact care. We hope these last 3 audits give you a snapshot of how you're doing in the hospital. And one of our goals going forward is to give reports to the hospitals, both on engagement with learning and performance. But as we move forward, over the next couple of months, one of the areas we really want you to try to think with your teams, ideally using some of the data you've been collecting in audits of really what are your smart aims and where do you want to, and try to get it on a piece of paper and ideally in an email that you send to Kimberly, so that we can learn what you're working on and get a sense, and that will also help us as we think of ways to learn from what you're doing and also to craft some of our content for the next year. These are some great suggestions on some of our micro lessons and where to target some of the work after April of next year. And so I would say thinking a lot about smart aims, what do you really want to improve? And some of that is going to be what's the right targets in your centers and the settings you care for, and then with baseline data. And then as we move on, we'll talk about strategies and using quality improvement science really in December on how you might use science in terms of testing on a small scale and kind of considering test of change and changes you want to make in your systems. Education is a core underlying all of this. And so part of our efforts are to have this be a forum for education over the course of this initiative, where we can bring outside speakers and experts on a variety of topics to have bite-sized learning through the micro lessons on Train. But we also want to have this be an opportunity to learn from what you're doing and really to try to have this is important work that all of you are doing. I know for many of you, this is your hospitals are participating volunteer. This is something you're doing because you value improving nutrition and care of mothers and babies. And so we want to make sure that what we're doing is supporting you adequately. So always please reach out if there's things that we can do. And again, wanted to thank everyone for all of the effort you're putting in and engagement with the monthly audits with this initiative.
Thank you, Dr. Patel. Any final questions? I just wanted to give another reminder about the October audit. You'll see that coming out October 24th. If you have any questions about that or anything else, please reach out to me. And as I mentioned, when we looked at our education plan in November, webinar will be about keeping mother and baby together and opportunities to optimize outcomes there. We will see you all in November. Thanks, everybody.